Welcome back to Somatics Meets Pelvic Health. We began this week with connecting to our pelvic floor, for relaxing our pelvic floor, using the breath to help guide the movement of our pelvic floor. And it's not an easy technique. It's simple, but it's not easy to make this connection. And so we're going to try a different position. And we're going to notice how this position changes our experience of trying to connect deeper, and especially to an area that we don't always think about or recognize or connect with. So for this exercise, you may want to find a carpeted area or a yoga mat. We want you to be comfortable, or even having a pillow that you can use for support. And what we are going to do is going to do child's pose. And so you're going to be on your knees. And of course, if your belly's a little bit bigger, you're likely going to need to make a more open V shape to make more space for the belly. And we are going to get into a position where we bring our hands forward. So you can have your elbows bent, you can have your arms fully straight, you can have your chest down, and you can even place your head down on the ground for full support. The position, the exact position, what's important is that you are comfortable. And we are going to come back to this idea of breathing to expand into our pelvic floor. And so it may be helpful to have your hand and touching your butt to find your sits bones, so the bones in your butt, and touching them, like kind of pressing a little bit into them, not too hard to cause pain, but just pressing enough that you're like, okay, yep, that's the bone. And then using the two bones as your landmarks for your breath, feeling if you can get a sense of an expansion between the 2 points and a contraction on the exhale. So noticing those points. And you can always retouch the area if you need to make that mind-body connection to that area. And this position also opens and stretches the pelvic floor. So it's a very open pelvic floor position, an open hip position. So you're going to get a little bit of release from that. And then we're going to try to get the breath to expand a little bit further. Okay, so we're going to get into a comfortable position. We're going to put our hands out. And then we're going to just start off by taking a breath in through the nose, out through the mouth, and now we're going to think about breathing in to our buttocks. So you're going to try to take the breath and expand it deeply into your pelvic floor. And let's try that for a couple of breaths. Just noticing if you feel any subtle movement around the perineum, around the openings of your pelvic floor. Just noticing if you can feel any expansion or noticing if you feel any tension. Maybe you feel some tension or some stretch. Just noticing the area of your pelvic floor. Noticing the movement of your breath in the body. Maybe noticing the two bones. Maybe touching those two bones so you can feel them again. And then just trying to breathe into those two bones. And exhaling. Inhaling. Exhaling. Just noticing, feeling your body. Sensing the movement of the breath in your pelvis. Exhale. Maybe even taking a moment just to feel the position. Do your hips feel open? Does your back feel some less pressure? Maybe noticing that this position is not comfortable for you at all. Maybe needing to switch and just be up on your arms. Maybe going all the way down doesn't feel good for you, or maybe too vulnerable. Coming up on your arms, seeing if that feels better. Seeing if you can make a better connection with gravity and your breath. Just noticing what you notice. And then we're going to slowly come out of that position, not too quick, not too fast. And then allowing ourselves to just get a little bit settled into our seated position. Letting the receptors in our body and our blood pressure make adjustment to the position change. How did that feel? How did today go? How did this position feel compared to a seated position? Did you notice something different about your pelvic floor in this position compared to sitting? Did you find it easier or harder? Was it less frustrating, or was there still a little bit of frustration? Just noticing what you notice without judgment. Learning to connect to the pelvic floor may seem simple, but not easy. Or maybe it was really easy for you, and just noticing that. And so that's the end of the exercise for today. And tomorrow we will try a different position. And then we will just notice how that position feels. On that note, have a great day.